Let's look at some specific tests that you will undergo when you go see a doctor or a physical therapist. This is excluding radiology tests such as an X-ray or an MRI, which ultimately is the best way to ascertain if you have a rotator cuff tear that's causing your shoulder pain. The first test is an impingement test. A doctor many times will use this to determine if you have an external or internal impingement. The first test that he will do is to have you raise your arm up to about 90 degrees or parallel, and what he'll do is he'll apply some pressure on the top of your shoulder, stabilizing your shoulder blade, and then rotating your arm inwards. This usually will indicate if you have an internal impingement. The second test he would do to determine if you have an external impingement is to have you raise your arm up to about 90 degrees. Your arm would be up at your side, and he would rotate your arm outwards. Your forearm will be moving up towards the ceiling, and if you feel pain with that movement, it could indicate external impingement. He'll also do a rotator cuff tear test. A rotator cuff tear test many times would be, for example, a drop arm test. This is usually done where you would raise your arm up to your side and just be asked to hold your arm up there. If you're unable to lift your arm up, many times this could indicate, or hold it up parallel to your shoulder, it could indicate a rotator cuff tear. The doctor might also do a resistive exercise or resistive test. So, for example, trying to push your arm against a resisted abduction could indicate a supraspinatus tear. If you have pain against, for example, external rotation, this could indicate an internal rotator tear or a infraspinatus tear. The third test that could be done is to look at your posture. Your posture is important because changes in your upper spine, called your thoracic spine, the way that your shoulder blades or scapulas are positioned, can affect the joint space in your shoulder, also known as the glenohumeral joint space. So a physical therapist in many instances would look at your head position, your shoulder blade positions, the way that your upper back is positioned, and they would do a variety of tests. For example, a therapist might ask you to stand up against a wall. If you are unable to keep your head, shoulders, buttocks, and feet up against the wall, and it's hard for you to keep your head back, this could indicate a forward head posture deficit. They would also look at your posture from the front. If you have what we call protracted shoulders, and your hands, or one hand in particular, is positioned more in front of your body instead of hanging to your sides, this could indicate protracted shoulders and shoulder blades that have slided forward, causing a narrowing of joint space in your shoulder, which ultimately could lead to impingement. A loss of thoracic side bend movement might indicate tight latissimus dorsi, and this could also lead to increased impingement in your shoulder. The therapist might ask you to stand up against a wall and just have your arms out to the side and just side bend each way. If you feel a increased pulling sensation in the side of your rib cage, this could indicate tightness. Tight hip flexors can be tested with the warrior stance test. This test, you're probably familiar, and you see many people doing this position in yoga, And this is a good way to test if you have tightness in the front of your hip. If this is hard for you to keep your back straight while your one leg is bent forward and the back leg is outstretched, it can indicate tightness. Many times, because we sit so much, these muscles get tight and it affects the position of your spine, which ultimately affects your shoulder joint space. Lastly, weakness in your buttock and hamstring muscles can be tested with a bridge test. Weakness in these muscles can lead to changes in your spine, which ultimately can affect your shoulder joint. So if you have been diagnosed with a rotator cuff, here are some reasons why you might need to consider surgery earlier than later. The biggest reason is because the humerus head is not stabilized in the shoulder joint, and when there is excess of movement, it can lead to changes of the bone, which ultimately leads to conditions such as osteoarthritis and rotator cuff tears. This can become very, very painful conditions which can affect the quality of your life.